Furcation involvement refers to the pathological loss of bone in the area where the roots of a multi-rooted tooth divide, most commonly due to periodontal disease. This condition is particularly significant in dentistry because it affects the stability and prognosis of affected teeth. The furcation area is essentially the space between the roots, and when bone loss occurs here, it can compromise the tooth's support. Understanding furcation involvement is crucial for both dental professionals and patients, as early detection and management can help preserve natural teeth and prevent further complications. In this video, we'll explore the anatomy, causes, diagnosis, and management of furcation involvement. To understand furcation involvement, it's important to know the key anatomical features. The root trunk is the undivided portion of the tooth root, located between the cemento-enamel junction, CEJ, and the point where the roots separate. The root cones are the divided portions that form the furcation region. The furcation itself is the area between the roots, while the furcation fornix is the roof of this space. These anatomical landmarks play a major role in how periodontal disease affects multi-rooted teeth and influence both the diagnosis and management of furcation involvement. The primary cause of furcation involvement is bacterial plaque, which leads to chronic periodontal inflammation and subsequent bone loss. However, several anatomical and structural factors can increase the risk. These include a short root trunk, root concavities, the degree of root separation, cervical enamel projections, and accessory pulpal canals. All these factors can make it easier for bacteria to colonize the furcation area and harder for patients to maintain proper oral hygiene, thus accelerating the disease process. Furcation involvement is classified using Glickman's system, which helps guide treatment decisions. Grade 1 represents an early lesion with slight bone loss. Grade 2 is characterized by partial bone loss, often described as a cul-de-sac. Grade 3 is a through-and-through lesion, but the furcation is still covered by gingiva. Grade 4 is also a through-and-through lesion, but it is clinically visible due to gingival recession. Understanding these grades is essential for accurate diagnosis and effective management. Furcation involvement is most commonly seen in mandibular first molars. Clinically, it is often associated with periodontal pockets, abscess formation, tooth mobility, and root caries. These features can make the affected tooth more difficult to clean and maintain, increasing the risk of further periodontal breakdown. Radiographs are used to confirm clinical findings, but probing with specialized instruments remains the most reliable method for detecting furcation involvement. Accurate diagnosis of furcation involvement is essential for effective treatment planning. The neighbor's probe is the instrument of choice for detecting furcation involvement clinically. While radiographs can provide supportive evidence, they may not always reveal the full extent of bone loss in the furcation area. Therefore, clinical probing is considered more reliable. Early and precise diagnosis allows for timely intervention, which can significantly improve the prognosis of the affected tooth. The prognosis of furcation-involved teeth depends on several factors. Mandibular molars generally have a better prognosis due to their root divergence, which allows for easier access and cleaning. In contrast, maxillary molars and premolars often have a poorer prognosis because their anatomy makes access more difficult. The degree of bone loss, patient's oral hygiene, and the presence of systemic diseases also play important roles in determining the long-term outcome. Managing furcation involvement requires a combination of traditional and advanced therapies. Traditional treatments include scaling and root planing, gingivectomy, curettage, odontoplasty, and osteoplasty. Surgical procedures such as root resection, hemisection, bicuspidization, and root separation may be indicated in severe cases. Regenerative therapies, including bone grafts, guided tissue regeneration, and the use of alloplasts or allografts, aim to restore lost bone and support. The choice of treatment depends on the severity of involvement and the overall prognosis of the tooth. Root resection is a surgical procedure reserved for severe furcation involvement, advanced bone loss, or untreatable root defects. However, it is not suitable for every patient. Contraindications include poor oral hygiene, systemic diseases that affect healing, fused roots, and untreatable endodontic conditions. Careful patient selection and thorough assessment are essential to ensure the best possible outcome when considering root resection as a treatment option. Furcation involvement remains a challenging periodontal condition that requires careful diagnosis and tailored management. Early intervention and meticulous plaque control are critical for improving the prognosis of affected teeth. By understanding the anatomy, risk factors, classification, and available treatment options, dental professionals can provide better care and help patients maintain their natural teeth for as long as possible.